Medication absorption is the movement of a drug from its site of administration into the blood. Oral drugs enter the stomach, where they either dissolve and pass through the cell membranes of epithelial cells lining the stomach, or travel undissolved through the stomach to the small intestine, which is the most common site of absorption. Here, drugs dissolve and pass through the intestinal wall. Oral drugs then travel through the portal venous system to the liver, where they undergo the first pass effect. During this process, the liver metabolizes some of the drug, either inactivating it or excreting it into bile for elimination from the body. The remaining amount of active drug leaves the liver and reaches general circulation and target organs. If a drug is administered via intravenous injection, it passes directly into the bloodstream, thus bypassing absorption in the GI tract. If administered through intramuscular or subcutaneous injection, the drug enters either muscle or subcutaneous tissue, where it passes through gaps between cells into capillary walls, and then into general circulation or target organs, also bypassing absorption in the GI tract. Bioavailability is the net amount of a dose of a drug that is actually absorbed into the bloodstream. The bioavailability of oral drugs is less than 100% because of the first pass effect of the liver. In contrast, the bioavailability of IV drugs is 100% because they are not exposed to the first pass effect of the liver. Different drug formulations alter bioavailability because they are not absorbed at the same rate or to the same extent. For example, tablets dissolve at varying rates. Enteric-coated drugs dissolve in the small intestine, not the stomach. Because gastric emptying time differs between individuals, absorption times also vary. Sustained-release formulas contain tiny spheres that dissolve at different rates, resulting in a steady drug release through the day, but also resulting in variable absorption. Some factors affecting drug absorption are the rate of dissolution. Drugs that dissolve faster are absorbed faster. Surface area. Since the lining of the small intestine has more surface area than the lining of the stomach, most drugs are absorbed faster in the small intestine. Blood flow. The greater the concentration gradient between the drug-filled stomach and the rapidly flowing drug-free blood, the faster the absorption. Lipid solubility. Highly lipid-soluble drugs pass through the phospholipids in the cell membrane more easily than drugs of low lipid solubility. And pH partitioning. Absorption is faster when the difference between the pH at the site of administration and the pH of the plasma attracts more drug molecules to ionize in the plasma. Distribution is the process by which a medication is carried to its target tissue or site of action with the goal of causing a therapeutic response. This process follows medication absorption and precedes medication metabolism. Medication is first carried to highly vascularized tissues, including the liver, heart, kidneys, and brain. Then, medication is widely circulated within the body, reaching areas of less extensive blood supply, such as skin, muscle, and fat. Medication then accumulates in the fat and in poorly vascularized tissues like bone, especially if the medication is lipophilic or strongly attracted to lipids. In the blood, some medication molecules bind to plasma proteins to which they are attracted. In this bound state, medication molecules are unable to produce a pharmacological effect. In bound and unbound form, the medication flows through the arteries and into capillaries. Capillaries carry the medication close to the tissue's cells, where hydrostatic pressure drives molecules between the capillary endothelial cells into the interstitial space. Some protein-bound macromolecules are too large to pass through the vessel walls, so they never reach the target tissue. Unbound or free molecules do reach the target tissue by exiting the bloodstream between the loose junctions in the capillary endothelium into the interstitial space to interact with the tissue cells. Some molecules bind to the cells, while others remain in the extracellular fluid. The interaction of the unbound medication with the target tissue results in a therapeutic response. There are many factors that affect distribution. For example, the effect of membrane permeability on distribution can be demonstrated in the brain. The brain's capillaries are impermeable to the majority of medications due to the blood-brain barrier, a membrane that blocks the entrance of both toxic and therapeutic substances into brain tissues. Some medications penetrate the blood-brain barrier based on features like low polarity and high solubility in lipids. Fat-soluble molecules cross cell membranes faster than water-soluble molecules due to the lipophilic nature and phospholipid composition of the cellular membrane. Factors such as body fat percentage and disease also affect medication distribution. Fat deposits retain lipid-soluble, unionized medication and release the molecules over time. Thus, obese patients may experience prolonged pharmacologic effects. Inflammation, disease, and injuries such as burns can alter protein levels and thus medication binding, increasing capillary permeability and uptake in cells and tissues. As a complication of kidney disease, albumin cannot bind medications effectively, resulting in a low percentage of protein-bound medication. These shifts result in high levels of free medication circulating throughout the body.
السلام عليكم. لا تنسوا الإعجاب بالفيديو والاشتراك في القناة تشجيعاً لنا لنستمر بنشر المزيد إن شاء الله.